Chapter 12, Drugs, Microbes, Host, the Elements of Chemotherapy. Pharmacology is defined as the science of drugs, including materia medica, toxicology, and therapeutics. The properties and reactions of drugs, especially with relation to their therapeutic value. These broad classes of chemicals include, but are not limited to, alcohol, caffeine, and penicillin, and are subdivided by use. Drugs. Hold on 1 second. These broad classes of chemicals include, but are not limited to, alcohol, caffeine, and penicillin, and are subdivided by their use. Drugs or agents that are used to treat any disease are called chemotherapeutic agents. Chemotherapeutic agents are described with regard to their origin, range of effectiveness, and whether they are naturally produced or chemically synthesized. Agents used to treat infectious diseases are called antimicrobial agents. We're going to have a lab where we will use some of these antimicrobial agents in the form of antibiotics. So you may have some E. coli or Serratia marcescens or some other microbe on a petri dish, and then you're going to divide it into quadrants and put one little diskette of penicillin, one spot, then you're going to put some chloramphenicol in another spot, or some 5 different antibiotics that you are going to put on your petri plate. Put it in the incubator and see what happens. Is that resistant to the antibiotic? How resistant is it? Or is this a good antibiotic? Now, I can tell you that the answer for the one that is that looks like it gets everything, is chloramphenicol. But don't go to the doctor and tell him about chloramphenicol, because I did that. And that man said, "Ma'am, where did you get that idea?" I said, "I teach microbiology at Lawson State, and chloramphenicol was the one that got most, whether it's Staphylococcus aureus or whatever it is." He said, "I hadn't heard anybody say that word since back in the," he said, "Where you teach, you say?" I don't care about what you say. But anyway, they don't use chloramphenicol anymore. But we use it, and you will see what it does. All right. The goal of antimicrobial chemotherapy is deceptively simple. I said I was going to go off, didn't I? And then I went off again. The goal of antimicrobial chemotherapy is deceptively simple. Administer a drug to an infected person that destroys the infective agent without harming the host cells. Antimicrobial drugs are selectively toxic. What does that mean? Right. Whatever the specific case is, some drugs can be toxic to you. In other words, the bad parts of it outweigh the good, the toxicity. Antimicrobial drugs are selectively toxic. These drugs specifically target microbial processes and not the human host cellular processes. Drug administration. The goal of drug administration is to get an effective concentration of the drug quickly to the site of infection. Minor infections of the body surface, such as athlete's foot, can be treated by external therapy, local or topical. What's something you can put on athlete's foot? What? Lotrimin, okay. Systemic therapy is the drug enters the patient's bloodstream through intravenous, intramuscular, oral, or inhalation. Now, we don't want any systemic, we don't want anything that is going to cause us a problem with going through our bloodstream. What does sepsis mean? S-E-P-S-I-S. When somebody's about to die and you take them to the emergency room and the doctor says they are in sepsis. Huh? Okay, infection of the bloodstream. That infection has gone all over their body, right? Because it's in the blood. Intravenous administration introduces the drug directly into a vein, and it is the fastest way to get high levels of a drug into the bloodstream. Intramuscular administration introduces drugs into the muscle, usually by injection into the arm or buttock. The drug reaches its peak level in the bloodstream within 15 minutes because muscle is richly supplied by blood vessels. Oral administration, PO, when they say take it PO, the drug is swallowed orally. This is the simplest and most common way to administer a drug, and it's painless. There are some new classes of antibiotics that are formulated from the traditional drug classes. 3 recent additions that are completely new drug types are phosphomycin, Synarcid, and daptomycin. I don't think these are new right now, but they were new. Synthetic antibacterial drugs do not originate from bacterial or fungal fermentations. Some were developed from aniline dyes, and others were originally isolated from plants. Although they have been largely supplanted by antibiotics, several types are still used. Why are synthetic antibacterial drugs needed? Why? Why do you think? You think that they might have been trying to find something that really worked and none of the ones that came from bacteria, because bacteria is used to make drugs. Fungal fermentations are used to make drugs. But synthetic, some were developed from aniline dyes and others were isolated from plants. They've been largely supplanted by antibiotics. Several types are still used of synthetic drugs. Agents to treat fungal infections present special problems in chemotherapy because the cells of fungi are what kind of cells? Eukaryotic. The great majorities of chemotherapeutic drugs are designed to act on bacteria and are generally ineffective in combating fungal infections. Secondly, the similarities between fungal and human cells often mean that drugs toxic to fungal cells are also capable of harming human tissues. Antiparasitic chemotherapy. The enormous diversity among protozoan and helminth parasites. So we have looked at some protozoans. I don't think we actually saw any worms when we did that lab, did we? Okay. But presently, a small number of approved and experimental drugs are used to treat malaria, leishmaniasis, trypanosomiasis, amoebic dysentery, and helminth infections. When's the last time you saw a baby with a worm infection? Did you know that that existed? It used to be so prevalent, but now you don't hear of babies having worms. Where did we used to see the worms? In the stool, in the feces. Antiviral chemotherapeutic agents present unique problems because this is an infectious agent that relies upon the host cell for the vast majority of its metabolic functions. So without even going to the next slide, what do you think would be a problem with getting rid of a virus, an antiviral chemotherapeutic agent? It might also harm the host. And selective toxicity with regard to viral infection is almost impossible to achieve because a single metabolic system is responsible for the well-being of both the virus and the host. Viral diseases such as measles, mumps, and hepatitis are routinely prevented by the use of effective vaccinations. So a chemotherapeutic drug is any chemical used in the treatment, relief, or prophylaxis of a disease. Prophylaxis, what does that mean? The use of a drug to prevent imminent infection of a person at risk. Antimicrobial chemotherapy is the use of chemotherapeutic drugs to control infection. Antimicrobial, all-inclusive term for any antimicrobial drug, regardless of its origin. So whether it's an antibiotic that is made from some bacteria, or whether it is a different drug altogether, it is antimicrobial, is all inclusive. Antibiotics are substances produced by the natural metabolic processes of some microorganisms that can inhibit or destroy other microorganisms. Semi-synthetic drugs are chemically modified in the laboratory after being isolated from natural sources. So it started out with a natural source and then they chemically altered it. But that's a semi-synthetic. But a synthetic drug is the use of chemical reactions to synthesize antimicrobial compounds in the laboratory. A narrow spectrum drug is limited. It's an antimicrobial that's effective against a limited array of microbial types. For example, a drug effective mainly on gram-positive bacteria. Gram-positive bacteria, the cell wall is made primarily of... Thank you. See, when you learn, you're supposed to keep it. You know, everything in chapter 4, 5, 6, 7, 11, 12, 13, 14. And a broad spectrum drug is an antimicrobial that's effective against a wide variety of microbial types. For example, a drug effective against both gram-positive and gram-negative bacteria. It's probably about 2 Fridays away when we do gram stain. So the mechanism of action, the bacterial cell wall, nucleic acid synthesis in antiviral drugs, protein synthesis, they help stop protein synthesis. They work on the cell membrane, antifungal drugs do, and folic acid synthesis. These are the mechanisms of action. So here we have a cell that we have cell wall inhibitors. You see the cell wall, the brown cell wall all around the cell there. What are some of these drugs? Now there's a chart in your textbook, your ebook, that shows what each of these drug types are and the examples of the drugs that do it, that perform whatever it is trying to describe. So cell wall inhibitors, what do? They block synthesis and repair of the cell wall. Some examples are penicillin, cephalosporins, carbapenems, vancomycin. Vancomycin is one of the ones that we're going to put on our little petri dish to see what its action is. Bacitracin, like my son used to take Bactrim. That is a what kind of drug? BAC, bacitracin. Sulfur drugs. I like sulfur drugs. If I could have given him some pure yellow sulfur and a little honey, I can't say what else. Phosphomycin and isoniazid, drugs that cause selective loss of selective permeability of the cell membrane, are polymycins and daptomycins. But that chart that I referred to a minute ago in the back of the chapter 12 in the textbook is a good easy way to remember these. So if you look at that sheet. DNA RNA inhibits replication and transcription, inhibit gyrase unwinding enzyme. Quinolones inhibit RNA polymerase, rifampicin. Then there are those drugs that inhibit protein synthesis, acting on the ribosomes. So look here. What are some drugs that prohibit protein synthesis and act on ribosomes? In the 50S subunit of the ribosome, which is the larger one, right there, erythromycin, clindamycin, synarcid, and pleuromutilins. Then the ones that work on the small, the 30S subunit, aminoglycosides, gentamicin, streptomycin. You've heard of streptomycin. What people take streptomycin for? Strep throat. Tetracycline, glycocyclines. And those that act on both the 30 and 50S block initiation of protein synthesis, linezolid. So what prevents folic acid synthesis? It blocks the pathways and inhibits metabolism. Sulfonamides, which are what? Sulfur drugs, and trimethoprim. Trimethoprim. Okay? Why is it better for a drug to be microbicidal than microbistatic? Why? And you won't be worried with it anymore. Why do you think there are fewer antifungal, antiparasitic, and antiviral drugs than antibacterial drugs? Fewer, because can you take a drug for a cold? You can do something, take some drugs to reduce the symptoms. They can stop your runny nose or stop your cough or something, but the actual virus, the cold, can you take a drug for a cold? No. So why do you think there are fewer antifungal, antiparasitic, and antiviral drugs than antibacterial drugs? Because I want you to answer the question and I'm listening. Toxic to you? Okay, that is correct, especially for antivirals. Because you take an antiviral drug, who is it also affecting besides the virus? You, it's affecting you. So what is the selective toxicity of that drug? I mean, how is it going to harm me? It might be something that I can just blow off, huh? Or it might be something that my body can't take. So the reason why there are fewer is because in the case of viral drugs, is because they affect the host as well. What's the difference between antibiotics, semi-synthetic, and synthetic drugs? Antibiotics are made from what? Yes, many of them are. What about semi-synthetic? They come in originally from what? Natural sources, but in the laboratory, scientists do what? Some chemical that makes them part synthetic. Semi-synthetic. Started with the natural source, got changed. And synthetic drugs are they made from any living organism? No. There aren't a lot of questions on the quiz about the specific drugs, but there are some. So I would think that you would want to know at least one drug from each of the main classes of antibiotics. Aminoglycosides, streptomycin. Cephalosporins, cefadroxil. Fluoroquinolones, have you heard of Cipro? It came out a few years ago and it was just all the rage. Glycopeptides, an example is vancomycin. Macrolides, an example is erythromycin. Penicillins, amoxicillin. Sulfonamides, Bactrim. Tetracyclines, doxycycline. Have you ever heard of doxycycline before? What's it used for? Oh, did y'all want me to stay on that? I'm not going to say for sure, but I think it's for some female genital.
Oh.
Main classes of antibiotics. Take a minute to get them in your brain. There are many different types of penicillins. Amoxicillin is but one. You got two more? Hurry up now, because you know I'm about to go off again. I thought about 5 things I want to say. Here we go. And again, this just tells whether they are broad spectrum or narrow spectrum. A narrow spectrum drug is more specific. A broad spectrum drug can affect both gram-negative and gram-positive. It affects a wider class of disease. Aminoglycosides are broad spectrum, inhibit protein synthesis. They are natural, produced from Streptomyces and Micromonospora. They are used to treat infections caused by gram-negative bacteria. They work quite well, but bacteria can become resistant to them. The effect is bactericidal. You like that one, Miss Fuqua? Fuqua. I said it wrong, didn't I? Bactericidal. It kills it. Cephalosporum is broad spectrum, derived from Cephalosporium acrimonium. It blocks cell wall synthesis. 4 generations of cephalosporins exist based on their antibacterial activity, and they are closely related to the penicillins used to treat pneumonia, strep throat, staph infections, tonsillitis, bronchitis, otitis media, various types of skin infection, and gonorrhea. Also commonly used for surgical prophylaxis. Fluoroquinolones are broad spectrum, inhibit the making of DNA, and do they come from natural sources? No, it's synthetic, used to treat most common urinary tract infections, skin infections, and respiratory infections, sinusitis, pneumonia, bronchitis. Bactericidal, kills it. Glycopeptides are narrow spectrum. They target the cell wall. They are natural. They're used to treat staphylococcal infections that have become resistant to penicillin and methicillin. Macrolides are broad spectrum. They are natural and semi-synthetic. Used to treat respiratory tract infections, genital, gastrointestinal tract, soft tissue infections caused by susceptible strains of specified bacteria. There's that specific bacteria because action is mainly bacteriostatic, but can also be bactericidal in high concentrations. In high concentrations, what will it do to me? Penicillin, narrow and broad spectrum, both. Block cell wall synthesis, natural and semi-synthetic. It's used to treat skin infections, dental infections, ear infections, respiratory tract infections, urinary and gonorrhea. Sulfonamide, sulfur drugs. Inhibits folic acid synthesis. Broad spectrum, synthetic, used to treat acute UTIs and certain protozoan infections. Tetracycline. Broad spectrum, inhibit protein synthesis, natural and semi-synthetic. It's used to treat mild acne, Rocky Mountain spotted fever, Lyme disease, upper respiratory tract infections, urinary tract infections, sexually transmitted diseases, and typhus. I think a tetracycline was doxycycline, and I told you that I thought it was some genital. Antifungal drugs. What do they work on? Fungus. Large complex steroidal structures, some toxicity to humans, commonly used for skin infections, targets the cell membrane, loses selective permeability. Examples are amphotericin B and nystatin. Limited drugs are available for antiviral. They are difficult to maintain selective toxicity. Why you want it selective? Because you want it to affect the virus, but you don't want it to affect the host. Effective drugs target viral replication cycle, entry, nucleic acid synthesis, assembly, and release. Interferon is an artificial antiviral drug. That cycle that we studied and we had in chapter 4 or 5 of, that must have been chapter 6, that talks about viral replication. Other types of antimicrobials are antiprotozoan, metronidazole, treats giardia, antimalarial, quinine, malaria. Have you heard of quinine before? Have you heard your grandmama, your granddaddy say quinine? They used to take that a lot. Antihelminthic, anti-what? Worm. Mebendazole for tapeworms and roundworms. Probiotics versus prebiotics. What do you take probiotics for? Digestion. What else? Okay, what is a prebiotic? Let's look at it. Probiotics are use of live microorganisms that are fed to animals and humans to improve the intestinal biota. An example is, this says Activa. It could be Activia. Because what's in Activia? These probiotics. Prebiotics are nutrient supplements that encourage the growth of beneficial microbes in the intestine. So prebiotics are trying to give us more beneficial microbes in the intestine. E. coli in the stomach, a certain strain of it, is it good for us? What does it do, the good strain? Vitamin K, it produces vitamin K. E. coli H70157. a strain that oftentimes lettuce, greens, that's our most common knowledge of it. Do we want any H7O157 E. coli? No. So controlling microorganisms through the use of probiotics improve intestinal biota. So that's kind of trying to get the what? The bad microorganisms, or the ones that are bad for us, trying to improve those. And prebiotics are beneficial microbes, putting some good microbes inside you. Maybe this is your intestine, your gut. The probiotics, the big bad boys here, and here's the little prebiotics. Probiotics are alive, usually bacteria or yeast, aid digestion and other health benefits. Good sources are yogurt, kefir. Anybody ever had any kefir? Buttermilk? You don't like buttermilk? Y'all never ate buttermilk and mashed cornbread up in it? Okay, I'm with your grandma. Aged cheese, sauerkraut, kimchi. Who's had some kimchi? Let's see how diverse our eating habits are. I stand up and see who says yes. Who has had kimchi? You have? Okay, tell us about it. What is it? Preserved cabbage. Okay. Okay. Thank you. See that? Okay, that is not pickled, but it's what you said? I know it's cabbages. Vinegar? Okay.
But we prefer it really spicy.
I like spice. Sourdough bread, miso. Who knows what miso is? You never had any? Tempeh, kombucha. Y'all lived some sheltered lives, didn't you? Beer and wine. Do you know what that is? Yes. Prebiotics are the form of fiber. They serve as food for probiotics. Good sources are chicory root, Jerusalem artichoke, and dandelions. Foods you'll actually eat. Garlic. I believe in garlic. You eat a spoon of garlic every day, you'll never be sick. Leeks. Onions. You don't like onions? Whole wheat. Now you know these days they tell you not to eat whole wheat, right? It's just changed. I mean, just every few years the whole pendulum swings. Eat only brown bread. Eat only whole grain bread. Eat only white bread that doesn't have gluten or something, gluten in it. So it just depends on what time you're living in as to what is recommended. Vegetables and legumes are prebiotics. Antimicrobial resistance. Drug resistance is an adaptive response to which microorganisms begin to tolerate an amount of the drug that would ordinarily be inhibitory. Resistance can be either natural or acquired. Increased drug resistance requires new approaches for developing effective antimicrobials. I don't think this will play. There are many different ways that microorganisms become drug resistant, but they fall into three broad classes: acquiring new enzymes that can inactivate or destroy the drug, changing their cellular target upon which the drug acts, and excluding the drug from the cell or removing it once it has entered. Drug resistance takes the form of drug inactivation, decreased permeability to the drug, change in drug receptors. Where are these receptors? On the cells. Change of metabolic patterns. Oh, and this is what our lab is going to look like. Except we will have, instead of calling it ATB1, and look at how much growth we have around it, or if there's little growth, the zone of inhibition is no growth. These are labeled ATB 1, 2, 3, 4, 5, but we're going to actually know the real names of ours. Just for chloramphenicol, don't go to your doctor and tell him that you took microbiology and you know that chloramphenicol will get it. Can you give me some of that? Then this is the exact thing that we're going to do. Okay? This is called the zone of inhibition. All right, antibiotic market in 1995. That's a long time ago. Cephalosporins, penicillins, fluoroquinolones, macrolides, tetracyclines, aminoglycosides, glycopeptides, and all other systemic antibiotics. Here it tells us how much sales the drug had, the representative drugs from that class, and infections that have developed resistance. So is it likely now that pneumonia, people will give you, the doctor will give you a cephalosporin. If it has developed resistance to the drug, you have to have another drug. How do you prevent drug resistance? Limit drug use, less selective pressure. Proper drug use, viruses are not affected. Use full dose to ensure elimination of the pathogen. Narrow range antibiotics kill only the targeted microbes, less likely complications. Multiple drug treatments, drugs can work synergistically, much less likely to get drug resistance. The interaction between the drug and the host, the side effects are a secondary and usually adverse effect. Side effects fall into one of three categories: organ toxicity, allergic reactions, disruption of normal flora. End of chapter 12. Let's see. Or maybe I wasn't recording just now. Yes, ma'am.